Hello, hi, good evening. Welcome to AccuCheck Wellthy. We are here back again with a new topic, and yes, we have a special guest for today. We are going to discuss a great, amazing, informative knowledge sharing session with all of you today. And don't worry, we are going to do it as a combination in English and Hindi so that all of you can understand it easily. Meanwhile, a warm welcome to all our lovely AccuCheck Wealthy family. Hello, Mr. Chakravarti. How are you? Good evening. Thank you for joining today's session. Hello. Hello, Mr. Ajay Kumar. How are you? I hope you are taking enough care of your health. Hello, Praveen ji. Good evening. Thank you for joining today's session. Hello, Jose. Hi. How are you? Thank you for spending your weekend time with us. Hey, Trinika. All right, let's wait for our AccuCheck Wealthy family and then we'll start with today's session. Hello, Mr. Terkhedkar. Good evening. Thank you for joining today's session. Hello, Mr. Rao. Good evening. We absolutely love you coming early and giving us an indication that you absolutely love our webinar sessions. Thank you so much for being associated with us in today's session. We are delighted to have you as a part of AccuCheck Wealthy family. Let's wait for our other members to join and then we'll start with today's discussion. Today's topic is quite knowledgeable, a lot of understanding with a new speaker, with our doctor, and we'll discuss about this shortly. Hello, good evening, Vivek ji. How are you? I hope you are taking good care of your health. Thank you for joining today's session. Hello, Shudhanshu. Good evening. Happy to see you early in today's session. Thank you for joining. Thank you, Mr. Chakravarti. I absolutely love your active participation in our webinars every week. Hello, Mr. Ashok. Good evening. Thank you for joining today's session. I hope you enjoy this session. I think this is the first time you've joined our session today. Thank you so much for being associated with the AccuCheck Wealthy family. We'll start with today's discussion shortly. We have a special guest, a doctor, who has specially come in to discuss about a special topic with us. Let's wait for another 2 to 3 minutes and then we'll start with today's topic. Meanwhile, I would love to know what are your plans for the weekend. Let's share how we can make our weekend healthy. What are the things we can do in our routine, in our lifestyle, in our eating habits, in our exercise pattern, in our day-to-day activities? How can we start incorporating healthy behaviors in our day-to-day routine? If you want to know about this, or if you want to give some suggestions, if you want to ask us some questions, feel free to drop in your chat messages in the chat box. All right, without any further wait, let's start with today's session. Today's topic for our AccuCheck Wealthy members is about foot care for prevention and management of foot ulcers. So just let me give you a little bit of background. Foot ulcers or foot prevention is important because diabetes is related to foot care. There are a lot of health issues which can take place if foot care is not maintained at regular intervals. How do you prevent it? How do you maintain it? What are the precautionary measures? How do you take care of your foot? How to avoid ulcers? What are the home remedies? How can you switch through your lifestyle? All of this we are going to learn today with our special speaker for tonight, Dr. Sneha Damse. She is a part of our clinical team associated in our doctor squad for Wellbe. She has been a part of Roche or AccuCheck Wellthy program for past more than 1 year. She is managing the therapy, the programs, the creation of the information which is available in the application. A doctor by profession with an experience of more than 10 to 12 years, with a patient base of more than 1,000 users all over, all lifestyle issues, all health concerns, all of the health issues with comorbidities. So don't refrain yourself from asking any kind of questions related to diabetes management, diabetes care, or your health management journey and its correlation with foot ulcers. Welcome, Dr. Sneha, to today's session. We are happy and delighted to have you with us today. And over to you to share today's topic and knowledge for diabetes management.
Thank you so much, Rituja, for that introduction. Like you mentioned, there is a direct correlation between diabetes as well as your foot. So there are various things that you need to do in order to take care of your foot, in order to prevent any kind of complications that may arise in the long term. Since you guys already know that diabetes is a very long-term disease, and if not properly taken care of, there are chances of various complications happening. Foot ulcers is one of the most common complications that occurs. In today's session, we will take care of how to essentially prevent those foot ulcers. And if you've already developed a foot ulcer, how should you manage it? What are the precautionary do's and don'ts that you need to take into account in order to take care of your feet? So let's start off with it. So, we've been talking about what are foot ulcers, how is it connected to diabetes, diabetes का इससे क्या connection है, diabetes तो blood में है, foot problems से इसका क्या connection हुआ. So, let me tell you how diabetes and foot problems are related. So, since diabetes is a very long condition, and over a period of time when there are very high blood glucose levels or very high blood sugar levels, it can lead to various problems, not just not just in your organs or something like that, but also related to your feet. So why do these problems occur, and why are we focusing so much on the foot problems that arise in diabetic patients? So let me tell you what the importance behind this is. So like I mentioned कि साल भर अगर आपका डायबिटीज कंट्रोल में नहीं रहा, आपके ब्लड शुगर लेवल्स काफी हाई होते रहे, तो वहां पे चांसेस आता है कि वो आपके नर्व्स जो होते हैं, आपके पैर में जो नर्व्स होते हैं जिसकी वजह से आपको सेंसेशन फील होती है, चाहे वो दर्द हो, चाहे वो ठंडा हो, गर्म हो, कुछ भी हो, ये सारी जो सेंसेशंस होती है, जब नर्व डैमेज हो जाता है, ये सारी सेंसेशंस आपके पैर से निकल जाती है, तो आपको फील नहीं होता. अगर आपको कभी कुछ लग गया पैर पे, आपको कोई इंजरी हो गई, तो आप रियलाइज भी नहीं करेंगे कि आपको इंजरी हुई है. तो इसीलिए थोड़ा इम्पोर्टेंट होता है कि हम इसके ऊपर ध्यान रखें. एक और कारण होता है कि आपको इसके वजह से फुट अल्सर या फुट इश्यूज हो सकता है, वो है कि जो ब्लड वेसल्स होते हैं आपके पैर में, जो ब्लड कैरी करते हैं, वो भी थोड़े डैमेज हो जाते हैं ब्लड ग्लूकोज की वजह से, हाई ब्लड ग्लूकोज की वजह से. तो जब ये वेसल्स डैमेज हो गए, तो आप समझिए कि आपके पैर तक बराबर खून नहीं पहुंच रहा. एंड अगर खून नहीं पहुंच रहा, तो अगर आपको वहां पे कोई इंजरी हुई हो या तो फिर कोई इन्फेक्शन हुआ हो उस इंजरी में, वो ठीक होने में काफी समय लग जाता है. एंड जब किसी चीज को, किसी इन्फेक्शन को, किसी इंजरी को काफी समय लग जाता है ठीक होने में, वहां पे चांसेस होते हैं कि वो अल्सर बन जाए. एंड हमको ये प्रिवेंट करना है ताकि वो छोटी मोटी जो इंजुरीज है, थोड़े कट्स हो या कुछ भी हो, उसको हम अल्सर में डेवलप ना होने दें. अब जैसे मैंने कहा कि नर्व डैमेज हो गया, तो आपको समझ में नहीं आता कि आपको कोई छोटी मोटी चोट पहुंची हो, या तो ठंडा लग रहा हो या गर्म लग रहा हो, आपको समझ में नहीं आएगा, जिसके कारण वो जो इंजरी होती है वो थोड़ी और बढ़ जाती है. इट बिकम्स if in a person, in a patient, if they are able to feel the sensations in their feet, it is easy for them to, notice it and take the proper action, whether it is to go to a doctor, whether it is to, put a small band-aid, clean the wound, put a small band-aid. But for people who have had, damage to their nerves or to their blood vessels in diabetes, they will not be able to take those actions. So as a result of these things that happen in a diabetic patient, there are high chances that they might develop a sore over there, a blister, a big cut over there, and not even realize it. And then these sores and blisters have the tendency or the chance of turning into an infection. And since there is no blood that is reaching this injury, this wound will not heal properly. And when something is not healing properly, there are chances of that infection getting worse. And then there are obviously other complications that can be associated with, injury not healing properly in time, which we will talk about, further on. But I hope that this gives you an idea of what happens to your nerves as well as your blood vessels when you tend to have very high blood sugar levels for a very long time. Now, the various problems that can occur in a diabetic patients when it comes to their foot problems could be due to poor circulation. जैसे मैंने कहा, जो blood vessels होती है, जो खून कैरी करती है आपके पैर को, वो डैमेज हो जाती है, तो आपके पैर तक बराबर से खून नहीं पहुंचाया जा रहा। फिर जो नर्व डैमेज होता है, जो उसके वजह से सेंसेशंस पैर में से चली जाती है, उसके वजह से प्रॉब्लम हो सकता है। फिर जैसे आपकी रोजमर्रा की जिंदगी में आप खुले पांव चल रहे हो, कहीं आपको कुछ लग गया, आपने रियलाइज नहीं किया, तो उसके वजह से भी कट्स हो सकते हैं। ऐसे छोटे मोटे जो कट्स है जो हम नोटिस नहीं करते, वो इन्फेक्ट हो सकते हैं, एंड ये इन्फेक्शन के कारण और भी कॉम्प्लिकेशंस हो सकते हैं। स्मोकिंग के कारण भी काफी फूड प्रॉब्लम्स हो सकते हैं डायबिटीज पेशेंट्स में, क्योंकि काफी स्टडीज हुई है, काफी डॉक्टर्स ने देखा गया है कि स्मोकिंग के कारण जो ब्लड वेसल्स होती है उसको डैमेज पहुंचता है, एंड अगर आपकी ब्लड वेसल्स डैमेज हो गए तो आपका सर्कुलेशन भी खराब हो जाता है। तो इट इज इम्पॉर्टेंट दैट स्मोकिंग नीड्स टू बी kept under control, or smoking needs to be stopped completely for diabetic patients. दूसरा कारण, और एक कारण किसी फुट प्रॉब्लम के लिए हो सकता है कि आप कभी शूज जो भी पहन रहे हो वो काफी टाइट हो, एंड जब आपके शूज काफी टाइट होते हैं, आप चलते हो, आपके टोज पे काफी इंजरी हो सकती है, थोड़े ब्लिस्टर्स फॉर्म हो जाते हैं, या आपने भी देखा होगा जब हम कोई नए शूज खरीदते हैं, so it is important that you take care of your shoes as well, and always buy the right size shoes that properly fit you and are not damaging your toes or the skin around your feet. And there are also chances of different deformities that can lead to foot problems, which I will talk a little bit in detail a little further on. Now, मैंने काफी कुछ कह दिया कि फुट अल्सर्स क्यों हो सकते हैं, कैसे होते हैं डायबिटीज पेशेंट में, बट ये भी जानना इम्पोर्टेंट है कि आपको कब और कैसे समझ में आए कि आपको नर्व डैमेज हुआ है या आपको ब्लड वेसल डैमेज हुआ है। तो उसके कोई साइंस एंड सिम्टम्स हो सकते हैं जो आप नोटिस कर सकते हैं, एंड अगर एक बार आपने नोटिस कर लिए तो आप अपने डॉक्टर को जाके बता सकते हैं, जो आपका फिर पूरा डायबिटिक चेकअप करेंगे, एग्जामिनेशन करेंगे, ब्लड टेस्ट करेंगे, which will confirm your diagnosis. So some of the signs and symptoms that patients might come across who have diabetic foot is tingling and numbness. So this is something that patients usually do. This is a sign of nerve damage. Over here you will feel sort of pin pricks, जैसे कि कोई सुई चुभा रहा हो, तो there is this constant sensation in your feet. कभी कभी कुछ पेशेंट्स को बर्निंग सेंसेशन भी फील होती हो, जैसे पैर बहुत ही ज्यादा गर्म हो गया हो और जल रहा हो, वो भी एक कॉमन सिम्टम होता है। जैसे कभी पेशेंट्स को इन्फेक्शन हो गया और उन्होंने रियलाइज नहीं किया, उसके कारण पैरों में सूजन हो सकती है। ये सिर्फ पैरों में नहीं, आपकी एडियो में भी हो सकती है, थोड़ा बहुत ये इन्फेक्शन ऊपर भी स्प्रेड हो सकता है, तो थोड़ा बहुत स्वेलिंग वहां पे भी आपको नोटिस में आ सकता है। नर्व डैमेज के कारण जो सेंसेशन आपका होता है, आपका स्किन जो सेंसेशन फील करती है, चाहे वो कोल्ड हो या फिर हीट हो, वो उसका सेंसिटिविटी जो है, या तो फिर जो सेंसेशन आपको फील होता है वो सारा यूजुअली चला जाता है। एंड उसके कारण, क्योंकि आपको वहाँ पे सेंसेशन फील नहीं हो रहा है, उसके कारण आपको डिफरेंट इंजरीज होने के काफी चांसेस होते हैं। जैसे मैंने कहा कि इन्फेक्शन होने के चांसेस काफी है, क्योंकि वहाँ पे ब्लड सर्कुलेशन बराबर से नहीं हो रहा है। तो आपकी जो स्किन होती है, उसको जब ब्लड पहुंचता है बराबर से, तो वो मॉइस्चराइज रहती है, वो हेल्दी रहती है, एंड आपका जो नॉर्मल स्किन कलर है वो दैट इज बिकॉज देर इज ब्लड बीइंग सर्कुलेटेड ओवर देयर। But in diabetes, when the blood vessels are getting damaged, the skin around your feet will become very dry. It will start peeling. आपके स्किन में थोड़ी क्रैक्स वगैरह आ जाएंगी, which can also ultimately then lead to ulcer formation. There can also be some changes that you will notice in your nails on the feet, such as them becoming yellow, them sort of swelling up, or them thickening. So that is one thing that can also happen. And then the various other things that usually people do see are different red spots or blister forming or ulcer forming over there. There is also like different kind of infection, maybe between the toenails, because toenails के बीच में जो area होता है वो काफी समय यूजुअली मॉइस्ट रहता है। एंड जब भी कोई जगह ज्यादा समय तक मॉइस्ट रहती है, वहां पे इन्फेक्शन, फंगल इन्फेक्शन होने के चांसेस काफी बढ़ जाते हैं। तो इन्फेक्शन, फंगल इन्फेक्शन इज ऑल्सो अ वेरी कॉमन सिम्टम दैट पेशेंट्स विल कम अक्रॉस। सो दीज आर द वेरियस छोटे मोटे साइंस एंड सिम्टम्स है जो पेशेंट्स को यूजुअली दिखते हैं, एंड इट इज इम्पॉर्टेंट दैट यू डोंट इग्नोर देम। इफ यू नोटिस एनीथिंग at any degree, kitna bhi kam ho, kitna bhi zyada ho, it is important that you go to your doctor and get a full examination done. Now, हमने काफी बात कर दी कि क्या क्या हो सकता है, कैसे साइंस एंड सिम्टम्स होते हैं, बट देन एक बार ये आपने साइंस एंड सिम्टम्स देख लिए, बट आप अपने डॉक्टर के पास नहीं गए या आपने प्रॉपर ट्रीटमेंट चालू नहीं किया, तो उससे रिलेटेड काफी कॉम्प्लिकेशंस होते हैं जो आप देख सकते हैं आपके पैर में। तो जैसे मैंने आगे कहा कि स्किन चेंज हो जाती है, पुअर ब्लड सर्कुलेशन की वजह से आपकी स्किन थोड़ी ड्राई हो जाएगी, क्रैक होगी, पील होगी, जिसके वजह से आपको इंजरीज होगी। कैलिसेस, सो कैलिसेस आपने काफी नोटिस किए होंगे, ये यूजुअली नॉर्मली भी काफी लोगों में होता है। कैलिसेस आर नथिंग बट थिकन्ड स्किन। तो आपकी एड़ी पे आप देख सकते हैं कि देयर इज लाइक अ स्पॉट जहाँ पे स्किन थोड़ी ज्यादा थिक होती है। जहाँ पे ये स्किन थोड़ी ज्यादा थिक होती है वहां पे अल्सर बनने के काफी ज्यादा चांसेस होते हैं, बट इट इज इम्पोर्टेंट that you don't try to treat this calluses at home. It is important that you go to your doctor to get a treatment done for that. There are sores, obviously, foot ulcers, definitely. Gangrene is a very end stage complication that can happen if you keep on ignoring your own symptoms. सो गैंग्रीन, अगर सिंपल शब्दों में बताया जाए कि आपके जो टिश्यूज होते हैं, आपके हेल्दी टिश्यूज जो होते हैं पैर में, वो दे दे एंड अप डाइंग. So the healthy tissue that you have, the living tissue that you have, that basically dies because there is very poor circulation. Your blood carries a lot of nutrients, your blood carries a lot of infection fighting agents, but if they're not getting the proper circulation, then the nutrients die off. If there is no immunity against infection, and because of this, the healthy tissues around your feet or around that specific wound will start dying off. And it becomes very important to seek medical attention for this, because if that gets ignored, I mean, in the initial stages, if the gangrenous spot is very small, if the gangrene that you have is like very is covering only a small area, then the doctor can easily clean the wound, they can remove the dead tissue, and then they can prescribe or they can treat you further on. But if the gangrene, it's essential to stop it right there. because if not treated properly, there are chances that the infection from the gangrene can go through your blood to different parts of your body, and that's something that we obviously do not want. And as an end stage to something like this, once the gangrene has spread a lot, there are chances that a lot of your healthy tissue ends up dying. And the only surgical treatment or the only medical treatment that the doctors can then give at this late stage is amputation, which is basically cutting off the affected or the cutting off the affected foot in order to get rid of the infection and prevent infection throughout the entire body. Uh, Other complication is also deformity. So, like I said, patients who have had nerve damage, they tend to not feel the sensations in their feet. So what can happen sometimes is that these patients end up having damage to their bones. And when a bone gets damaged, obviously, and you don't realize that your bone has been broken या फिर आपके bones को कुछ हो गया है, तो usually patients क्या करते हैं, अगर आपका fracture हो गया, तो you will go to a doctor. Doctor will set it correctly, उसको properly align करेंगे ताकि वो आड़ा टेढ़ा कुछ ना हो जाए. But for a diabetic patient who has had nerve damage, if these fractures go unnoticed, these bones will set on their own. And when the bones will set on their own, there will be a certain type of deformity. It will sort of maybe protrude out, or it might not fix itself properly. So that is a different kind of complication because of bone damage that can end up happening in patients. सो लेट्स से अभी तक हमने जितने भी पॉइंट्स कवर किए हैं उसके बेसिस पे आपको कितना समझा है, आपने कितना जाना है. लेट्स पुल अप अ पोल एंड हैव दिस क्वेश्चन फॉर ऑल ऑफ यू गाइज. So the question basically is, people with diabetes may not feel pain when a small cut or blister occurs on the foot. So is this true or is this false? Just answer the poll that has appeared on your screen. I hope everyone has answered the question. That's correct. Almost 95% of you have gotten it correct, which is true. People with diabetes do not feel the pain when a small cut or blister occurs on their foot, which will ultimately then lead to various complications that we just discussed previously. Okay, so we talked about a lot of, signs and symptoms, a lot of issues that can occur, a lot of complications that can occur. But I mean, it's also important to know that there are ways to prevent this. There are ways to take care of your feet, not just in order to prevent the formation of an ulcer or prevent any kind of an injury to the feet, but also if you've already developed an ulcer, how do you prevent infection? And how do you keep it safe from other complications that we currently discussed? So let's talk about some of the foot care techniques that you can utilize in order to maintain the function in your feet so that no deformity occurs, in order to prevent the ulcer, in order to prevent injury to the feet, in order to prevent early healing. Sometimes, when you get an injury on the feet, there are chances that once it goes ignored, once it's ignored, it will lead to the complication. But most of the time, if you notice it early on and you go to a medical professional to get it treated correctly, it will heal. It will heal properly, and then it will not lead to any kind of an infection. So let's see what you can do in order to prevent any of those things that we talked about. So, like I said, if you're not having sensation in your feet, you will not notice those ulcers or blisters or cut. So it is essential that throughout, it's essential that you inspect or you check your feet daily. तो आप जैसे ही शाम को कहीं बाहर से घर आते हो या तो एट द एंड ऑफ द डे, रात को सोने से पहले, आप आपका पैर चेक कर सकते हो किसी भी कट, ब्लिस्टर या फिर सूजन, कोई नेल प्रॉब्लम्स हो उसके लिए इट इज इम्पोर्टेंट कि आप सारा फुट चेक करें, सिर्फ ऊपर नहीं, पैर के नीचे भी चेक करें, नेल्स के टोज के बीच में भी चेक करें, क्योंकि जैसे मैंने कहा वहां पे फंगल इन्फेक्शन होने के काफी चांसेस होते हैं। तो आप आपका फुट एक बारी दिन में शाम को या रात को चेक कर सकते हैं, सो दैट एटलीस्ट यू आर अवेयर, आपको पता है कि कोई इंजरी हुई या नहीं, सो दैट आप अपने डॉक्टर को इमीडिएटली कांटेक्ट कर सकते हैं। जैसे आपके पैर में नर्व डैमेज हो जाता है, आपको थोड़ा सेंसिटिविटी भी हो जाता है किसी भी गरम चीज से या तो किसी ठंडी चीज से, तो हाउ डू यू टेक केयर ऑफ योर फीट इन दैट सिनारियो? You should end up sort of soaking your feet or bathing your feet in lukewarm water, ना कि ज्यादा गर्म ना कि ज्यादा ठंडा, थोड़ा बहुत जो भी इसके बीच में टेम्परेचर हो, आप उसमें अपने फीट को सोक कर सकते हैं। सोक करने के बाद उसको अच्छे से क्लीन कर दे, उसको डेली क्लीन करें, एंड the temperature, like I mentioned, it should not be very hot, it should not be very cold, because your feet are sensitive to those temperatures. So it's essential to maintain the optimum temperature while doing something like this. Now, after you've cleaned your feet, after you've soaked your feet, it is important that you don't take like a cloth and just scrub it out, or you're rough to your skin, because your skin is already very sensitive. तो जितनी भी कोशिश हो सके आप एक सॉफ्ट कपड़ा यूज करें या तो स्पंज यूज करें, कॉटन का कपड़ा यूज करें, और स्क्रब करने के जगह पे उसको बस धीरे धीरे ऊपर से टैप करके ब्लॉट कर दे, ताकि वो अच्छे से क्लीन हो जाए। एंड जब आप क्लीन कर रहे हो और जब आप ड्राई कर रहे हो, तब याद रखना कि आपके टोज के बीच में भी उसको अच्छे से क्लीन कर दे और ड्राई कर दे, क्योंकि जैसे मैंने पहले भी कहा था कि वहां पे मॉइस्चर हमेशा ज्यादा होता है, क्योंकि हमारे पैर हमेशा शूज में रहते हैं। तो फिर पूरे दिन भर इंडिया जैसी कंट्री में जब इतनी गर्मी होती है, तब देर आर चांसेस दैट वहां पे और भी पसीना आए, वहां पे और भी इन्फेक्शन होने के चांसेस बढ़ जाए। तो मेक श्योर दैट यू आर क्लीनिंग इन बिटवीन योर टोज एंड यू आर कीपिंग दैट एरिया ऑल्सो ड्राई। Since a lot of patients see that the skin around the foot has dried out because of poor circulation, it is important that you regularly moisturize your feet, but also keep in mind not to moisturize in between your toes. जैसे पहले कहा वहां पे .3 में कि टोज के बीच में ड्राई रखना ज्यादा जरूरी है, बट बाकी का जो आपका फीट है, आपका स्किन है, उसको मॉइस्चराइज रखना काफी इंपॉर्टेंट है, क्योंकि ड्राई स्किन की वजह से जब स्किन ड्राई हो जाती है तो वहां पे इचिंग वगैरह होती है, एंड व्हेन देयर इज इचिंग देयर आर चांसेस कि थोड़ी सी इंजुरी हो जाए, एंड उस इंजुरी की वजह से आपकी स्किन पील हो जाए, क्रैक हो जाए। That is not something that we want. So it is important that you moisturize your feet regularly, but prevent moisturizing in between your toes, because then that will again encourage fungal infections. Now the next one is obviously cutting your nails carefully. Now it is important that you don't cut it too short, because sometimes when you cut your nails too short, there is, जब वो वापस बढ़ रहा होता है, there are chances that it will grow into your skin, and if a nail grows into your skin, obviously it is cutting your skin, it is giving room for more infection to enter your skin. So it is important that you cut it at an appropriate length, and just आप ध्यान रखिए कि उसके edges ज्यादा sharp ना हो, ताकि वो आपको और इंजरी ना कॉज करे। And in case if you notice that there is any kind of yellowing, आपके nails yellow turn हो रहे हो, या तो फिर आपको वहां पे swelling दिखाई दे रही हो, तो आप अपने डॉक्टर को कंसल्ट करें ताकि कोई भी डायग्नोसिस हो वो उसको जल्दी से पकड़ के उसका ट्रीटमेंट जल्द शुरू कर दे। मैंने कहा था व्हाट कैलिसेस आर, सो कैलिसेस आर एसेंशियली जहाँ पे चमड़ी थोड़ी थिक हो जाती है एंड वहाँ पे देन इंजरी या तो फिर अल्सर होने के चांसेस भी ज्यादा हो जाते हैं इन डायबिटिक पेशेंट्स। नाउ व्हाट अ लॉट ऑफ पीपल एंड अप डूइंग, काफी लोग क्या सोचते हैं कि ओके यहाँ पे अल्सर ना बन जाए तो मैं घर में ही इसको काट दूं या मैं घर में ही कोई ट्रीटमेंट कर दूं, बट इट इज इम्पोर्टेंट टू नो दैट you shouldn't be doing any of these things at your own home. Don't go to your chemist and get a medicated pad or a corn pad or a corn aid and try to do these surgeries at your own place. If you notice a corn or a callus, go to a doctor. They will give you the appropriate treatment. They will monitor it properly, because what will happen if you try to do this at home is sometimes you might end up injuring yourself, because obviously you're doing it at home. There is no medical professional present over there. So please go to a doctor if you notice something like this. They'd be the right people to take care of it for you. So in order to, prevent your foot from just getting injured on a daily basis, try to wear socks which are dry in nature. There are special types of socks that are available for patients with diabetes. And this essentially keep away the moisture from your feet. So that the external moisture does not impact your feet. It will keep it properly temperature regulated. Your feet will not get too cold or they will not get too hot, the ones that are specially made for diabetic patients. And it is important that you change them regularly, wear them clean every day. Like I said, there are socks that are specially made for patients who are living with diabetes. They will give you extra cushioning so that there's no injuries that are happening. And जैसे अपने रेगुलर सॉक्स में होता है कि ऊपर एक इलास्टिक होता है जो कभी कभी जब एकदम ही टाइट हो जाए तो वहां पे थोड़ा सा स्वेलिंग हो जाता है, आपको पैर पे स्वेलिंग देखने मिलता है. सो इट इज ऐसे जो स्पेशली मेड सॉक्स होता है, these don't have that elastic top, so it will prevent that injury from happening. And like I mentioned, the fibers are made in such a way, or the fibers are that are part of this that are part of these socks. They will keep the moisture away from the skin so that they are not extensively, they're not very wet or they're not very dry. They will be at the normal temperature as required. Now we also know that some people, कुछ लोगों के साथ ऐसा होता है कि रात को जब टेम्परेचर थोड़ा कम हो जाता है, अभी विंटर्स भी आ रहे हैं, तो we've noticed that the temperature at night time drops drastically compared to the temperature in the morning. तो ऐसे जो लोग काफी सेंसिटिव है कि उनके पैर रात को ठंडे हो जाते हैं बिकॉज ऑफ द टेम्परेचर ड्रॉप, उनके लिए एज वेल एज दूसरे लोगों के लिए इम्पॉर्टेंट है कि इन ऑर्डर टू प्रिवेंट योर फीट फ्रॉम गेटिंग कोल्ड, कि आप रात को भी सोने से पहले सॉक्स पहन के सो जाए. एंड just because it is cold, that does not mean that you can just start using a heating pad or soaking your feet in hot waters. It's important that you keep it at the right temperature. So try to wear socks if you're very sensitive to cold, especially at night. Every time you sort of when you're going out and you're wearing your shoes, or you're coming back and you're taking off your shoes, sometimes we don't notice that there's like a stone, कोई पत्थर shoes के अंदर घुस गया. हम ये usually notice नहीं करते. And for diabetic patients who have this kind of damage, they might not feel the pain, or they might not even realize that while wearing their shoes there is a stone inside the shoes. Now what will happen in case you wear such a shoe that has like a stone inside it is that you will end up getting injured. You will end up getting cuts on your feet. So every time you try to put on your shoes, just be mindful, or notice, try to shake your shoes before you put them on. See if there's anything inside your shoes that can cause injury. Try to take care of it. Try to remove it before putting them back on, so that you don't get injured later on. Like I said, it's important to keep your feet dry. uh, the more moist you keep it, the more wet they are, there will be increased chances of there being infections, especially fungal infections. So in rainy seasons or during monsoon seasons, where there's a lot of rain, it is important that you keep your feet dry by wearing warm socks, or just cleaning them up whenever they're getting wet, cleaning them up gently, not being too harsh on them. That's the important point to keep in mind. Now, sometimes there are conditions in, in patients where there's excessive sweating. बहुत पसीना आ जाता है क्योंकि shoes पहनते हैं, socks पहनते हैं, तो obviously there are chances that you will sweat a lot. Now, like I said, if your feet are always wet, whether it's because of water, whether it's because of sweat, there are chances of there being increased chances of you getting an infection. So it is important, in order to prevent that excessive sweating, अलग type के sprays आते हैं जिसको antiperspirant sprays बोलते हैं. इसको आप शूज पहनने से पहले या सॉक्स पहनने से पहले आपके सोल पे स्प्रे करके फिर बाद में पहन सकते हैं आपके शूज एंड सॉक्स, ताकि आपको ज्यादा स्वेटिंग ना हो. अभी हमारे यूजुअली इंडियन हाउसेस हम क्या करते हैं, हम घर भर यूजुअली बिना शूज के चलते हैं, बिना सॉक्स के चलते हैं. दैट्स यूजुअली हाउ वी आर. बट इवन एट होम, घर पे भी देर आर चांसेस कि फ्लोर पे कुछ गिरा हो, या तो फिर any kind of thing that can cause an injury. You might not even notice that you're stepping on it. So it becomes important that you don't walk bare feet. आप हमेशा कोई स्लीपर्स, सॉफ्ट शूज या कोई सॉफ्ट स्लीपर्स पहन के घूमें, ताकि आपको कोई स्क्रैच या कट ना हो. तो आप जब भी घर में चल रहे हो तब भी आप ध्यान रखिए कि आप किसी चीज पे स्टेप नहीं कर रहे हो जो आपको कट्स कॉज कर सकती है. The most important thing, obviously, you can take care of everything else, you can go to your doctor, but what is in your hands also is that you take proper care of your diabetes, you keep your blood sugar levels under control. Because जैसे हमने सबसे पहले यही बात कही थी कि जब किसी को डायबिटीज काफी समय तक होता है, एंड इफ द ब्लड शुगर लेवल्स आर वेरी हाई फॉर अ वेरी लॉन्ग पीरियड ऑफ टाइम, all of this damage will end up happening. So in order to prevent that from happening, it is important that you keep your blood sugar levels under control. If your blood sugar levels are obviously under control, then there are very less chances that something, the nerve damage or the blood vessel damage will end up happening to you. So the most important tip is to keep it under control, follow your doctor's advice, follow your health coach's advice, and don't let it get too high. Smoking, like I mentioned, causes damage to your blood vessels, and when there is damage to your blood vessels, there is less blood flow happening to your feet as well. So do not smoke in order to prevent something like this. एंड ऑब्वियसली आपने भी नोटिस किया होगा, आप अपने डॉक्टर के पास जब भी चेकअप्स के लिए जाते हैं, देर आर periodic foot examinations that the doctor also does. Even if you haven't reported any symptom, if you've not noticed any changes in your feet, doctors usually on an annual basis, साल में at least एक बारी या फिर 6 महीने, depending on what their protocol is, at least साल में एक बारी एक foot examination जरूर करते हैं, to see if there's any complications from the diabetes that are happening, the foot complications from diabetes that are happening. So also maybe if if you think that there's something happening, then you can request your doctor to maybe periodically increase that frequency of examination as well, and they will do it for you. So get it checked regularly from your doctors, because sometimes what ends up happening is that uh, we might not realize that we have signs and symptoms. Maybe the signs and symptoms are very mild, so we will ignore them. We will think it is something else, but it might be due to, the diabetic complications that we talked about, diabetic neuropathy that we talked about. So even if you don't think you have any signs or symptoms, ask your doctor for those periodic examinations so that they can catch it early in the early phases. And anything that gets caught in the early phases is way better to treat, uh, as compared to something that gets complicated and is at a later stage. So it's best that it gets caught early on, so as to not develop complications. Okay, guys, I think we've covered a lot of tips and a lot of do's and don'ts on how you can, prevent something like this from happening. Now, let's see what else have you grasped from this. We have one more poll. We have one more question for you guys. Let's see if you can answer this as well. So the most important way you can prevent diabetic foot problems are: A, keeping blood sugar and your HbA1c within good range; B, wearing well-fitting shoes; C, never going bare feet; or D, all of the above. Let's see. Okay, we have the results over here, and it seems like 86% of you have answered it correctly. So the correct answer is all of the above. All of the above. So in order to prevent all of the problems that we talked about, it is important to keep your blood sugar under control. You have to wear well-fitting shoes in order to prevent any injuries from happening. Do not go barefoot, because like we mentioned, if you go out barefoot, you will not notice if there's anything that is causing you an injury. So yes, the answer is all of the above. This is what you have to do in order to prevent that problem from happening. सो काफी कुछ बोल दिया, कि मैंने काफी बारी कहा है आपको कि अगर आप कुछ नोटिस करते हो तो आप डॉक्टर के पास जाइए, यू सीक मेडिकल अटेंशन. But there are obviously certain things that you can keep in mind before going to the doctor, or if you start noticing these things, then go to your doctor or seek medical care. So if you observe the following things, it's very, very important that you go back to your doctor and get a checkup done. So changes in skin color, yellowing of the skin, redness of the skin. If your skin has turned black or blue, so redness तो आपको पता होगा, अगर कोई infection है तो उसकी वजह से वो लाल हो जाती है. But when does the skin turn black or blue? That's when gangrene has set into your skin or the wound, basically, because the healthy tissue that is around that wound has started dying off, which causes the dark color or the black color around the wound itself. So any changes in skin color, changes in temperature in the foot or ankle, obviously, if there is an infection happening, your skin will be a lot more warm, or it will be a lot more hot to touch. So if there's any such change that is happening, go to your doctor. Dry cracks, when the skin is very dry, it will crack very easily. And when it is cracking very easily, it will cause it will easily get infected. It will easily allow infection to enter it. So if there's any dry cracks in your skin, especially around your heel area, it is important that you get any infection in the early stages treated. Now, any kind of unusual or constant pain, अगर आपको realize हो रहा है कि काफी दिन से, काफी समय के लिए, दिन भर आपके पैर में, आपके फुट पे आपको पेन फील हो रहा है, which is like burning in nature, or it's tingling and numbing in nature, then that would also be a sign of diabetic complications. Any kind of an open wound that you have on your feet that has not healed for a very long period of time, it's very slowly healing or it's not healing at all, that also requires immediate medical treatment. If your toenails have sort of have gotten infected with a fungus, or if your nails have started growing into your skin, which is called ingrowth of nails, that then also it is important to take care of it medically. And of course, like I mentioned, do not treat your calluses at home. Go to a doctor. They will take care of it medically, surgically, whatever needs to be done, they will do it. It is important that you don't perform these surgeries at home. For anything, we've everything that we've covered over here. If you don't have any questions right now, but something pops up later on, if you think that, oh, us seminar mein ye bola tha, now I need to reach out, then just reach out to your health coaches. They're always accessible. Ask any questions, any specific questions that are regarding your foot health. They'll be happy to answer it. I'll be happy to answer it. I hope you guys have, gotten some kind of knowledge from this on how to prevent and take care of your foot ulcers, and hoping that you start implementing these practices in your daily activities as well. Thank you so much, guys.
Wow, Dr. Sneha, I have to say, knowledge shared in simple method is always useful. Thank you so much for sharing connection between foot ulcers, diabetic foot, and how to take care of your feet during diabetes management. Uh, I know our AccuCheck Wealthy family and our AccuCheck Wealthy users, and most of them are comfortable in Hindi most of the times. So if you could just give us a brief summary of what all did we learn today and what are the important points जो उन लोगों को याद रखना जरूरी है on a day to day basis, it will be really great.
Yes. So जैसे हमने कहा कि डायबिटीज में ब्लड शुगर, हाई ब्लड शुगर के कारण आपके नर्व्स, जो पैर के नर्व्स होते हैं या ब्लड वेसल्स होते हैं, वो काफी डैमेज हो जाता है. उसके कारण आपके पैर में कोई भी इंजरी होने के चांसेस बढ़ जाते हैं, या तो फिर उसके वजह से आपको सेंसेशन फील नहीं होती. तो जब कोई सेंसेशन आपको फील नहीं हो रही है, वहां पे चोट लगने के चांसेस भी बहुत बढ़ जाते हैं. अगर आपने ये जो चोट लगी है आपके पैर पे, ये आपने नोटिस नहीं की, तो उसके चांस होता है कि वो हील नहीं होगी, और अगर कोई चीज हील नहीं हो रही है काफी समय तक, तो वहां पे अल्सर बन जाता है. एंड अगर उस अल्सर का ध्यान नहीं रखा गया, तो काफी चांसेस है कि और कॉम्प्लिकेशंस हो सकते हैं. तो इन ऑर्डर टू, ताकि आपको ये अल्सर ना हो या तो आपको इंजरी ना हो, आपने क्या करना चाहिए? आप अपने पैर की इंस्पेक्शन थोड़ी बहुत करिए, रोज रोज करिए, शाम को करिए. पूरा पैर चेक कीजिए, ऊपर नीचे, हील्स पे, सोल्स पे, सब चेक कीजिए. टोस के बीच में चेक कीजिए, ताकि वहां पे कोई कट्स, ब्लिस्टर्स, सोर्स, कोई भी किसी भी प्रकार की चोट ना हो. वो सबसे इम्पोर्टेंट है कि आप डेली उसका इंस्पेक्शन करें. आप वेल फिटिंग शूज पहनिए. आप ऐसे शूज ना पहने जो बहुत टाइट हो. कोई भी शू जो ज्यादा टाइट होता है वो आपको ब्लिस्टर्स दे सकता है, आपको कट्स दे सकता है. तो ऑलवेज वेयर शूज जो आपको बराबर से फिट हो रहे हो. कीप योर फीट ड्राई. आप अपने पैर को सूखा रखिए. अगर वो गीले हो गए हैं तो उसको अच्छे से साफ कर लीजिए. उसको स्क्रब ना करें, उसको किसी सूखे कपड़े से अच्छे से ब्लॉट करके सुखा दे, या तो कोई स्पंज यूज कीजिए जो उसको ड्राई कर दे. आप अपने पैर को बिल्कुल ही ठंडे पानी में या बिल्कुल ही गर्म पानी में उसको सोक ना कीजिए, ताकि इसकी वजह से आपको इंजरी होने के चांसेस थोड़े ज्यादा बढ़ जाता है। तो उसको ज्यादा ठंडे या ज्यादा गर्म पानी में ना रखें। आपके जो टोज होते हैं उसके बीच में मॉइस्चर ज्यादा होता है, वहां पे गीलापन ज्यादा होता है, तो ध्यान रखिए कि आपके टोज के बीच में आप ड्राइनेस मेंटेन रखें। वहां पे मॉइस्चराइज ना करें, क्योंकि आपने टोज के बीच में अगर मॉइस्चराइज किया तो चांसेस होता है कि वहां पे फंगल इन्फेक्शन हो जाए। पर ये भी जरूरी है कि आपकी जो फुट की स्किन होती है, जो इस डैमेज के वजह से ड्राई हो जाती है, आप उसको आप उसको मॉइस्चराइज करें। तो आप जब भी मॉइस्चराइजर्स यूज कर रहे हो तो वो आपकी स्किन पे यूज करें, पूरे पैर पे, बस टोस के बीच में ना यूज करें। ये भी ध्यान रखिए कि आपका जो ब्लड शुगर लेवल है वो प्रॉपरली मेंटेन्ड हो, वो ज्यादा समय तक काफी हाई ना हो, क्योंकि ऑब्वियसली ये जो भी प्रॉब्लम्स हमने डिस्कस की है वो हाई ब्लड शुगर के कारण होती है। तो इट इज इम्पोर्टेंट कि आप उसको कंट्रोल में रखें। आप उसको पीरियोडिकली, जो आपके डॉक्टर्स है, आपके डायबिटोलॉजिस्ट है, उनसे रेगुलरली फुट एग्जामिनेशन करवाइए, क्योंकि चांसेस होते हैं कि आपने नोटिस नहीं किया हो, आपको कोई सिम्टम्स हो, आपकी कोई प्रॉब्लम्स आपने नोटिस नहीं किया हो, पर डॉक्टर्स यूजुअली इसको जल्दी पकड़ लेते हैं। तो अगर कोई बीमारी आपको किसी अर्ली स्टेज में हो तो डॉक्टर्स उसको काफी जल्दी पकड़ लेंगे, उसका ट्रीटमेंट जल्दी हो जाएगा, कोई कॉम्प्लिकेशन नहीं हो जाएगा, कोई कॉम्प्लिकेशन नहीं होगा। ये भी ध्यान रखिए कि आप जब भी घर में चल रहे हो तो आप स्लीपर्स यूज करें, आप किसी भी तरह की चप्पल यूज करें, ताकि आपको इंजरी ना हो जाए, क्योंकि घर पे भी अपने कभी कोई चीज पड़ी हो तो कभी उसमें पैर दे दिया तो वहां पे कट होने के चांसेस थोड़े बढ़ जाते हैं। तो उसको अवॉइड करें, घर पे भी स्लीपर्स पहनिए। अ, अगर आपके पैर को ठंड से सेंसिटिविटी हो, कि रात को वो काफी ठंडे पड़ जाते हैं, तो रात को सोने से पहले भी सॉक्स पहनिए। अगर दिन में भी आपके पैर सेंसिटिव रहते हैं तो डायबिटिक पेशेंट्स के लिए इस बीमारी के लिए स्पेशल सॉक्स बनाए जाते हैं, जो आपके पैर से मॉइस्चर दूर रखते हैं, ताकि उसमें इन्फेक्शन ना हो। तो आप वैसे टाइप के सॉक्स भी यूज कर सकते हैं। उसके वजह से भी आपको थोड़ी एक्स्ट्रा कुशनिंग मिलेगी, आपके पैर थोड़े पैडेड रहेंगे, विच विल प्रिवेंट इट कि आपको आगे जाके कोई और चोट ना पहुंचे। सो दीज आर, ये थोड़े बहुत टिप्स एंड टेक्निक्स है जो आप फॉलो कर सकते हैं। अगर आपको ऑलरेडी कोई अल्सर हो या तो आपको प्रिवेंट करना हो, आपको चाहिए कि आपको अल्सर ना हो, कोई कॉम्प्लिकेशन ना हो, तो आप इसको रेगुलरली आपके दिन ब दिन की एक्टिविटीज में फॉलो कर सकते हैं। अगर इसके अलावा आपको कोई क्वेश्चंस हो, मैं आंसर कर सकती हूँ, आपके हेल्थ कोच आंसर कर सकते हैं, आप ऐप में वो क्वेश्चन भेज सकते हैं एंड दे विल बी हैप्पी टू आंसर इट।
एब्सोल्युटली। थैंक यू डॉक्टर स्नेहा कि आपने हिंदी में भी हमारे सारे यूजर्स को एक समरी एक्सप्लेन की। कुछ हमारे यूजर्स हैं जिन्होंने कुछ क्वेश्चंस पूछे हैं, लेट अस एड्रेस दोस क्वेश्चंस। हेलो प्रवीण कुमार जी, थैंक यू फॉर बीइंग एक्टिव इन टुडेज सेशन। सो डॉक्टर स्नेहा, मिस्टर प्रवीण इज आस्किंग what should be the normal blood sugar levels for a healthy person? So
ओके,
can you just give him a rough range of
श्योर,
fasting,
या,
post meal, random, and HbA1c as well?
oh, just give me 1 second, there's someone, just give.
No worries. So meanwhile, Dr. Sneha is back. Let me tell you, connection between diabetes and foot ulcers is very very strong. I hope आपने आज डॉक्टर स्नेहा के साथ कनेक्ट किया हो. Just to let you all know, this year is coming to an end, and with this we are also going to revise our rates, our renewal charges. So if you not have renewed your plan till now, please ensure you speak to your health coach. Ask them what are the discounts which are currently running, because we are still running with the diabetes week discounts. If not done already, there are some great offers on trial plans, there are some great offers on yearly plans. Please do reach out in case if you want to buy the programs, or renew the programs. For more information, drop a message to your current health coach asking for what are the rates of renewal, and she'll definitely help you out. Meanwhile, Dr. Sneha is back. All of you, please drop in your queries in the chat box, and I will ensure that your question is asked and we together will respond on your query.
Hi guys, so sorry.
No problem, Dr. Sneha. We completely
Yes.
understand. We were discussing about the renewal plans we have, and
Mhm.
what is it that we are coming up with for the next year. We have Mr. Praveen who has asked us about blood sugar levels. So, if you can help him with a response.
Sure. So I think Mr. Praveen wanted to know what are the normal blood glucose levels for people who might not have diabetes. So there are different kinds of, I hope you guys can hear me. Uh,
Yes, yes, you're audible. Please go
So
on.
there are different types of blood glucose tests as well that are done. So there can be a fasting where fasting blood glucose level where the patient has fasted for 8 hours before getting the blood test done. Then there is a blood glucose that is usually measured before meals, and then there's a blood glucose test that is done after meals to check how your body is reacting to different kinds of meals. So usually for people who don't have diabetes, the fasting blood glucose levels need to be somewhere between, and this changes for everyone. Sometimes it can be normal, but on a global level, the normal fasting blood glucose needs to be below 100 milligram per deciliter, anywhere between 70 milligrams per deciliter to 100 milligrams per deciliter would be considered normal. In between these range for people who do not have diabetes, anything below 70 becomes low blood sugar, and then this can cause you other problems. But these are the normal levels after meals. Usually, for a patient, for people who are not suffering for diabetes, the range is a little bit higher because after eating any kind of meal, your body will generate a lot more glucose because there is a lot of carbohydrates that you are eating. So your blood glucose levels tend to go up, but there is a normal level, there is a range, or there is a cutoff beyond which it becomes high blood sugar level. So for any post meal blood glucose level, it has to be below 140. It can be equal to 140 milligrams per deciliter or a little below that. And that needs to be in range after the meals have happened. If after you have eaten something, it goes above something like that, then you could like get checked up and see if you have diabetes or not. But these are essentially some of the most widely recognized or most widely followed range. It is usually a little bit different for patients who are suffering from diabetes because their cutoff is a little bit higher. They already have diabetes. So what is normal for a diabetic patient and what is normal for a non-diabetic patient usually changes depending upon their own condition and their own past history as well. So yeah,
Okay, thanks for that brief information, Dr. Sneha. We have few more users who have put in question. Let's talk to them.
sure.
Hello, Mr. Sanjeev. Thank you so much for joining today's session. We are glad you could take out some time on the weekend. Dr. Sneha, Mr. Sanjeev wants to know what kind of moisturizer can be used for foot care.
गॉट इट. सो आप जो यूजुअली हमारे मार्केट में हम मॉइस्चराइजर्स देखते हैं, जो हमको किसी भी दुकान से या किसी सुपरमार्केट से ले लेते हैं, इट्स यूजुअली recommended that you don't just recommended that you don't use these moisturizers because they have fragrance, they have a lot of other chemicals that are present in this moisturizer. If you don't have access to any other moisturizer, you can go ahead, but usually recommended not to use something like this. There are moisturizers out there that are medicated and they are a lot more gentle to the skin as well. So one of these could be, if you have seen at your chemist shop, there are moisturizers like Cetaphil, Sebamed that are very gentle and they are also medicated. They don't contain any harmful chemicals or any kind of fragrance that can cause further damage to your skin. So maybe go for the medicated moisturizers, but if you don't have access to them, you can still use the normal ones that we have, such as Nivea या फिर जो भी कुछ हो वो भी आप use कर सकते हो.
Great. Thank you so much, Dr. Sneha. Just to add to what information you give, Mr. Sanjeev, I think the best person to guide you on which brand to purchase, what is the type of medical moisturizer you should use, is your diabetologist. So, next time when you visit, please speak to your doctor and don't forget to follow Dr. Sneha's advice. Yes, we have few more questions. Let's address them, Dr. Sneha.
Yeah.
Hello, Ashok ji. Good evening. Thank you for being actively participating in today's session. So, Dr. Sneha, Mr. Ashok wants to know, is there a connection between diabetic neuropathy and foot ulcers?
यस सो मिस्टर अशोक, हमने जैसे पहले बात की थी, ये जो डायबिटिक न्यूरोपैथी है बेसिकली इसमें आपका नर्व डैमेज हो जाता है, राइट? तो अभी किसी भी जगह पे अगर आपके नर्व्स डैमेज हो गए हैं तो चांसेस है कि आपको वहां पे सेंसेशन फील नहीं हो रही है. जब कोई सेंसेशन फील नहीं हो रही है, आपको कोई चोट लग गई, इफ यू आर गेटिंग हर्ट, इफ यू आर गेटिंग कट्स, यू विल नॉट इवन रियलाइज दैट आपको वहां पे कट हुआ है या फिर आपको चोट लगी है. एंड जब आपको पता ही नहीं कहीं पे चोट लगी है तो वहां पे हील होने के चांसेस थोड़े कम हो जाते हैं. तो मतलब आपका जो भी इंजरी हुआ है उसको हील होने में भी काफी टाइम लग जाता है. एंड जब किसी वुंड को हील होने में टाइम लगता है तो वो अल्टीमेटली फुट अल्सर बन जाता है, क्योंकि उसका एरिया बढ़ जाता है, उसमें इन्फेक्शन हो जाता है, थोड़ा ब्लड सर्कुलेशन भी कम हो गया, तो there are chances of it increasing as well. So yes, there is definitely a major connection between diabetic neuropathy and foot ulcers, and that is why it is important to prevent any injury from happening to your feet.
Great. Thank you so much, Dr. Sneha. Mr. Jose, hello, good evening. Thank you so much for being associated with us, Mr. Jose, today. So, Mr. Jose has needs your advice that what exactly should he do. He experiences burning sensation beneath his foot, for few days from today. He also has done some nerve conduction study. So, is it normal? What should he do? Whom should he consult? Any kind of suggestions for him?
So, Mr. Jose, आपने कहा कि you have burning sensation in your feet, and we don't know the results of your nerve conduction test, but what it sounds like is that there could be something over there. But since we don't know the results to the test that you've already performed, it would be good that you take your tests to your diabetologist. They will check whether it's normal, whether it's abnormal. Based on whatever is the result, they'll be the best to recommend something to you. But it's best that you take your results to your doctor and talk to the diabetologist.
Great. Thank you, Dr. Sneha. Just to add, Mr. Jose, we cannot give any advice without checking any reports. I hope you understand. Please speak to your diabetologist. And still, if you have any questions, drop in a query to your health coach, and I will ensure that our doctor answers it for you. Okay. So don't worry. We are still there to support you. Just speak to your doctor once and get back to us. Okay, so there are few more questions. Let's just speak to those users. Mr. Rao, hello, good evening, Mr. Rao. I can see you are a great participation in today's session. Thank you so much. So, Dr. Sneha, Mr. Rao wants to know, is the sugar level measured with AccuCheck and pathology values same? Uh, is there a difference in the result?
Yeah, so Mr. Rao, ये जो AccuCheck के results होते हैं, since this is a test that is done at home, थोड़ा बहुत आपने जो lab results में देखा होगा, आप lab में जाके जब खून देते हो and अगर आपने AccuCheck से check किया तो there is usually a little bit difference, क्योंकि home test usually gives you like a quicker result. So थोड़ा बहुत variation होता है, थोड़ा बहुत ऊपर नीचे होता है. It is good to understand where it stands at right now, but I will say that there is a bit of variation, but not a lot of variation. It will still give you an idea of whether your blood sugar is under control, whether it's high, whether it's low. So you can trust, the AccuCheck device that you have. There are obviously slight variations that can happen with any device that we have. So it's important to keep that in mind. But it's also essential to get your blood test in a laboratory done at regular intervals so that you also get those values, because those are the ones that your doctor will also refer to, but the doctors are also referring to your AccuCheck values. So it's essential that you keep your blood test regularly monitored.
All right. Thank you, Dr. Sneha. We have few more questions. Let's address them. Hello, Mr. Chakravarti. I was eagerly waiting for your question. I knew that there would be some information you would love to know. So, Dr. Sneha, Mr. Chakravarti wants to know, is there any lubrication required before going to bed for diabetic foot care? And particularly, his little finger of the foot gets squeezed and he feels that it's need lubrication. What do you suggest, and what are some changes you want him to start with?
So, Mr. Chakravarti, if you feel like you need lubrication before going to bed, it's important. I mean, it's important to see whether your feet are like getting that dry at night, because you don't want to like over moisturize it or over lubricate it. So, what you can do is you can use like a light moisturizer before going to bed. Use socks also while going to bed, because that will keep your feet warm and it will keep them properly moisturized. It will help the moisturizer work better. So try to do that. Small, I think what you've mentioned is that your small little finger of the foot gets squeezed and hence lubrication is required. So sounds like something, uh, this sounds like the shoes that you're wearing are properly not the right size for you. So maybe try to get something that's a little bigger, so that your finger is not getting pinched. This might not be an issue with lubrication, but maybe with the size of the shoes that you're wearing. So maybe uh, try to get one size bigger, and see if that helps you. Yeah.
Great. Thank you so much, Dr. Sneha. So don't worry, Mr. Chakravarti, you can try for simple changes in your routine. And still, if you need some support, please drop in your questions. We are there to help you. So, Dr. Sneha, we have this last question, and thank you so much for being there in spite of the webinar timings. Uh, Mr. Jose, whom we just spoke to, has just confirmed that his reports of the test are normal. So, in case if the report is normal, what is it that he can follow? If quickly in one or two steps you can help him.
Sure. I mean, if you are feeling the symptoms, if your feet are burning and the nerve conduction tests are normal, it does not look like there is a lot of nerve damage over there. But maybe due to your glucose, the blood circulation might have reduced a little bit. I'm not sure, Mr. Jose, if you've discussed these results with your diabetologist or not, because they know your history, they know what other conditions you might have. Because if your tests are normal, there can be something else that is causing it. So, given your history, I think it's important that you talk to your diabetologist about these symptoms. But just keep a check, even if it's burning, try to keep a check whether there's an infection over there or not, whether there is redness or whether there's swelling in that area or not. Because, like I mentioned, the chances of you having an infection sort of increases when you have diabetes. So keep an eye out for any kind of infection on your foot that could also be causing something like this. But if that's not the case, then it is important that you check with your diabetologist, see if there's any other tests that need to be done over here, because your doctor is someone who knows your entire medical history, and they'd be the best to recommend what the next steps would be for you as well.
Absolutely. Thank you so much, Dr. Sneha, for addressing each user's concern and giving them a solution based approach. Thank you so much. We are really grateful for being a part of AccuCheck Wealthy family for today's session. Uh, To all our lovely AccuCheck Wealthy users, I hope you enjoyed today's discussion about foot care and diabetes management. Don't worry, next week we are coming up with a new topic, a new series of knowledge sharing. Till then, take care of your health. Bye bye.
Thank you, everyone. Have a good day.